Good afternoon. My name is Stephen Hicks, and I'm from the U.S. Department of Education. I think you have my slides, right? Great. So as a former preschool and kindergarten teacher, how many former preschool or kindergarten teacher or current are there in the room? Let's hear it for the teachers. Great. Wonderful. I think any time that we discuss issues that engage the wellness of young children, the educational achievement of young children, that we should definitely engage practitioners, and if we can't engage practitioners, at least former practitioners, to give that kind of insight about what it's like to be working with children and in classrooms. So I'm happy to see so many of you here. As a former preschool kindergarten teacher, I know that that all the domains of learning are important to prepare our children for success. And so it's not just the cognitive domains, while those are important, it's also making sure that children are healthy. Making sure they're healthy so that they can be in school, so they can be able to learn, to receive information, interact with other kids, and participate fully. Quality early childhood education really begins with healthy children. If they're not healthy, they're really not going to be able to learn. And through the two programs that my office has been working on, the Early Learning Challenge grants, and I know there are many of you that represent those states here today, and also the Preschool Development grants, we've tried to enforce this multiple dimension and domains approach to early education. So along with literacy and language development and cognitive learning and approaches to learning, we also have physical health and well-being, and that's really one of the top five, one of the big five domains, and treated equally. And in Early Learning Challenge, we supported states in their systems of early learning, and health promotion was a big piece of that. And in the Preschool Development grants that we just recently made those awards, and the first cohort of students began in 18 states in over 250 communities across the country, we had 12 different elements of what a quality high-quality preschool program must include. And one of those is comprehensive services, which would include screenings, which would include nutrition and supporting family engagement and understanding the value of making sure your children are healthy. I want to talk, besides those two grant programs, very briefly today about an opportunity that you have, this group has, and as individuals as well, to influence the kind of policies that are going to be at the federal level. A few months ago, we had a forum where we invited stakeholders, either virtually or in person, to come to the Department of Education to help us to develop a joint policy statement with the Department of Health and Human Services as our partner around health promotion. And this would be for birth to third grade, that whole early childhood continuum. And many of you probably submitted comments. We had over 300 comments that we received that we're trying to integrate into a statement that then we'll put out again for more feedback. So please do look for that. And at the end of the slide, there's our website where you can sign up for our listserv so you can be aware of those kind of opportunities and make that influence. The other thing I want to mention briefly is new guidance to support healthy students. Now, while this is primarily for schools, I think a lot of it can be applicable to early childhood settings that are community-based settings outside of schools. But I think as schools more and more take the responsibility of educating young children with 3-year-olds and 4-year-olds. In this city, my city of DC, all 3-year-olds and 4-year-olds are offered a high-quality early learning experience, and that must include taking care of their health needs as well. So in January, the Secretaries of Health and Human Services and the Secretary of Education came out with a Dear Colleague letter talking about how schools have a pivotal and important role to play in the healthy development of young children, and all students actually, and the kind of things that they could do and the kind of opportunities that they could take. So there are 5 different opportunities that's in this toolkit, and I'm hoping that Jana will, because we have a firewall at the Department of Ed. I couldn't upload these, but I'm hoping that Jana will upload not only my PowerPoint presentation, but also this toolkit so you can easily access it and start to share that in your communities to know that schools do have a role and a place to play. There's a lot of examples in this toolkit, so I won't talk about all of them, but I want to mention a couple in my 2 minutes that I have left. But there are these, the research is there. There's a lot of references in the toolkit for additional resource, and it really can be, I think, helpful as community-based settings and schools partner more and more. So the first opportunity has to do with helping eligible students and family members enroll in health insurance. And we know that when kids are getting accessing Medicaid and CHIP and other resources, they're going to have better outcomes and higher graduation rates. And we know that when eligible parents are also enrolled, their children will be enrolled as well, and they will have greater access. One of the exciting things that happened in California, in El Monte, California, is that when children enroll, they actually ask about their health insurance as well. So they've combined that with their enrollment, and they can find out if children and families have access to health care, and if they don't, they can connect them with resources. Another important opportunity is to provide and expand the reimbursable health services in schools. Schools can actually be reimbursed for these health services that they provide. And one community in Virginia has actually been able to recoup those funds from the state and then pour those funds back into their school system to provide health services such as a nurse at the school and provisions for children with disabilities. Another opportunity is to provide and expand services that support at-risk students and making sure that those students don't fall behind. And these kind of interventions can happen, for example, in Hayward, California, where they have case managers that are providing the necessary resources and education for families, including those on preventing obesity. The fourth opportunity is about promoting healthy school practices through nutrition, through physical activities, and health education. And we know that when the information is out there and when families have those tools to work with, they can see better results. And very quickly, the fifth opportunity is about building partnerships. And I know Sherry in the last session talked about how important it was to build those partnerships in the community for early childhood providers, maybe in community-based settings, but it's also important for schools to do that as well. Build partnerships with hospitals, with clinics, etc., so that families can get to those important resources. And I think schools have not done as much of a job stepping up and doing that. Finally, I just want to say that there's an opportunity with the new ESSA, the Elementary and Secondary Education Act that Congress just passed. There's a new preschool development grant program that was authorized that will still be jointly administered by Ed and HHS. However, it's been expanded to provide services for birth through 5 and give states the flexibility to use those funds where they need it. And I think there's an opportunity when we do begin to regulate on that, and as the department regulates on other provisions in the Education Act, for your voice about promoting children's health to be heard. Thank you.